There are some patients who come into the clinic with recurrent BV and Candida. What happens is they first have BV, bacterial vaginosis. They use strong antibiotics. What happens later is that the BV is wiped out, but Candida appears. Now with the Candida, they have UTI and they have difficulty having sex. This is a disastrous situation to be in, and it will cause some kind of friction between you and your partner.
So BV usually flares up in low estrogen states. Post period, when the Candida is quiet, it can flare up.
After you finish your period, your estrogen levels are usually low. This is the best time for BV to flare.
It's interesting when the peak happens of the estrogens. If there's Candida, it can flare up at that time, but BV can coexist and cause a lot of hypersensitization and everything else.
So BV can also mess you up when estrogen is high. What she's saying is that in peak estrogen states, when Candida is high, BV can also go up, which makes it very, very difficult to solve.
That also applies to other conditions where people flare up more premenstrually, right?
We might need to see where it peaks. We have to keep a diary of things as to when it peaks. And that will give us a clue as to what is going on. Ask them to check pH during the peaks. So if pH is not normal during those peaks, then there is another infection also going on, which takes us to BV. So it can coexist with BV. Usually for BV, in bacterial vaginosis, the pH can be more than 4.5. Whereas in Candida, it's less than 4.5. So if the pH is more than 4.5 in these cases, then I suspect there is a bacterial infection.
So you check for peaks, and then at the same time, you check for the pH.
We ask them to go for swabbing at that time.
So that you can find the positive because it's cyclical.
Yes.
Okay, I understand.
So I asked her how she treats patients with recurrent BV and Candida.
These patients are very resistant, and in these cases, you have to use both antibiotic as well as antifungal suppositories. So you finish the acute course of the medication, then we go for the herbal suppositories. We have lots of suppositories now available with all of these herbs already mixed in. So the patient is on the treatment with suppositories the whole month pretty much.
And then I asked her, what other things help?
The other things which we have seen also which helps are lactulose irrigation in BV, because it helps to improve the lactic acid and also decrease the pH. Lactulose irrigation has shown in some studies to help with the repopulation of the lactobacilli in the vagina.
Okay, understand.
It takes a long time to clear up, but it does get better. Everything needs to be addressed.
In summary, everything needs to be addressed. It's not just the bacteria or the fungus. I hope you found this useful. Listen on, because we have different videos on BV alone, Candida alone, recurrent BV and Candida, as well as one more, which is using too much probiotics causing another condition.